So, hi, I'm Yvette Raphael, and welcome to the Global Health Unfiltered podcast. The first thing we want to discuss is your very personal journey with HIV advocacy, and how you came to become an advocate for people living with HIV. Thank you.
Hi, thanks. First of all, thanks for inviting me. And yes, my story, as you would know, is very personal. I was diagnosed when I was 25 years old, just after giving birth to my daughter. And I soon realized that if I don't fight for myself, nobody's going to fight for me. At that time, it was yeah, I could say just after the Thabo Mbeki era, Mantu era, where medicines in South Africa was not actually, the government refused to approve medicines for people living with HIV in South Africa. And I I always say I was at the peak of my career at that time because I just got a new job, my child. I had a job with a medical aid, something that was not um, you know, very popular for people my age at that time. And I realized that it's going to be a tough one when I was faced with the issue around taking treatment. There was hurdles everywhere. Even though I could afford to take medication, as we know, taking your ARVs needs support. The doctor was a little bit sketchy, wasn't sure if he should prescribe me the meds because I didn't have a support system. And then decided to publicly disclose in my workplace. I had only known for about a month about my own diagnosis, and I decided to then disclose my status at work. And to my own surprise, my colleagues really was supportive, but most importantly is that they could speak to me confidentially around their own challenges of facing HIV, whether it was themselves or in the workplace or even their family members.
Oh, that's quite interesting. And this was 25 years ago. How did you really overcome that stigma? Because now it's well spoken about. We don't, people don't mind sharing. But
Mm.
25 years ago, I'm assuming, it wasn't, the stigma was still quite high, right? Compared to
Yes.
what it is today. So how did you navigate that situation, and what made you like come out and say, okay, it's okay. I'm okay to let people know.
I say it was a flight or fight era, the time where you're either going to fight for yourself or this thing is going to take you down. And I almost want to say I had a don't care attitude about what people say about me. They didn't know my life. Very few people would, even if they said I got HIV because I was promiscuous. I knew that that was not the case. I knew how I contracted HIV was not because of promiscuity. And I was prepared to answer those questions. But I think I just didn't care how other people felt because I had just brought into life a human being, a baby girl that needed her mother. And I realized that that was what made me want to fight and live. I remember, us Africans, we are very spiritual. We are very connected to our roots. And I went to my dad's grave and my grandmom's grave, and I told them, guys, you gotta make me live. And if you make me live to raise my child, I will raise other African children. Nobody crossing my path needing help, especially young girls, because I knew I was a young woman at the time. I knew that there's nothing that women could do to prevent themselves from getting HIV that made sense at the time. I mean, you would not be able to speak about condoms with your partner at that time. Condoms were not readily available. And if they were available, it was still the choice of your partner whether he wants to use it or not. I hear they've given this thing a name now. They call it stealthing. But removing the condom mid-sex was, normal during that time because somebody felt like it.
Yeah. I obviously the kind of behavior that should not be encouraged. You were mentioning earlier about your experience as a woman, a mother, and then thinking about your daughter. In your work, it is very evident that you have obviously a lot of empathy and compassion for people living with HIV, but you put an emphasis on women, as is in that case. So you've touched a little bit on that, but besides your personal experience, what has made you focus on women and young girls and HIV?
First of all, I'm a woman myself, and just know the challenges that we face in relationships. I always say as well that for you to understand HIV prevention, you need to understand the black bedroom and its politics. So nobody thinks there's politics in the bedroom, but there are politics. And I know that young women have so much ahead of them, and it can't just go away just like that in a flash. So my passion with young people is to give them confidence, to give them, the ability to see beyond their current circumstances. I know somebody saw my talent, somebody saw my, just how I saw life and what I wanted to be. But then came HIV, and that could have all changed if I did not have mentors, if I did not have aunties. You talk about stigma. If I did not have family member. I come from a very, very small village in Limpopo in South Africa. And in that village, everybody gossips about everyone, right? But when I told the women in my family, it was almost like, listen, nothing has changed. You are still the beautiful woman that you are. But most importantly, how do we support you? And how do we support you? Support us to deal with our children in our community, because I think they just felt at that time that I was strong. Although I wasn't strong, most of it was just, how do they say, winging it. But I needed to do that. I always say that was a defense mechanism. I laughed through things. I cried through things, but I never give up, because giving up is not a choice. My daughter is now 20. She's turning 26, but I still feel like this, all the time, there's something more I need to experience about her. I need to experience about my son. I need to experience about my kids, just to see their potential, but most importantly, other African girls, other young women, other women living with HIV, how they reach their potential is important for me to support, to ensure that women living with HIV see that example of somebody who is going through the motions and just not giving up. I don't like the strong black woman, lapel, but I'm saying that's the hill I'm willing to die on.
Wow, that's very powerful. And to hear that you were winging it and you've been winging it, and now we know you as this big advocate, and we've been hearing your voice for a long time now,
Thank
right?
you. Thank you.
In 2019, you did challenge Gilead's Dr. Mopalidas in Kigali, asking what are they going to do differently when it came to clinical trials, right? What do you think the past clinical trials have gotten wrong over time? And why is it important to ask very specific questions before the first participant is enrolled in any trial?
I think the participation of women in trials just go beyond being just participants. And at that time, it was 2019, my diagnosis in 2020. It was about 19 years of my experience in seeing how these things are done and seeing just how communities are left behind. Communities were used as tick boxes. Communities were just there to sit in a meeting, give their ideas, and somebody would run with it. And my question in 2019 was, because we had the experience. We had women like Nomfundo Ireland, Lillian Mureko, many women leading community engagement and saying, these things cannot continue to happen. We were also aware that people were just using us to get ideas. People were just using us to listen and ticking boxes. So in 2019, when Mopali Das from Gilead came and said to us she wanted to speak to women, for me, it's what were you going to tell us? What were you going to tell us about us? What are you going to do differently than all of these other trials? Remember, women have been part of trials for treatment. Women have been part of trials for PrEP. Women have been part of trials for microbicides, now the ring. Women have been doing this, but what is going to be different? We bring our bodies, but where is the return of investment for women? Previous trials excluded young people, and we know in Africa, SADC region, 16 to 24, that's where HIV thrives. That's where women are dealing with partners who don't want to use a condom, with, just the fact that they date older men and older men prey on them. I don't want to say that it's a young girl, 14 years old age problem for having an older partner. It's older men preying on them. And what do they have that they can negotiate? And I said to Mopoli, one of the things that we need to do is to ensure young women do participate in this trial. So when these medicines become available, like lenacapavir, we don't wait another 5 years for another study that says, okay, young girls and women can use it. Like many other products, we know the results don't come out clearly like that. And then another thing was pregnant and breastfeeding women. Women in Africa are a catchment age, and at that first clinic visit, you are introduced to AIDS whether you like it or not. You are introduced to HIV whether you like it or not. You are just going through, oh, I'm pregnant, I want to go to the doctor, and boom, somebody tells you, have you tested? Boom, you get tested. Boom, you're HIV positive. Then take ARVs for the fetus. I never call a fetus a baby, for the fetus, so that everybody, oh, you must protect your partner, your community, everybody. But what is there beneficial for them to go through all of that? Because our bodies also goes through the most when we are pregnant. And I felt, and I said to Mopoli, if we agree that pregnant and breastfeeding women are part of the trials, then they would benefit from this medication the minute it becomes available, because HIV prevention is just that. Like I said, for an HIV positive woman, she would be on treatment, she would immediately ensure the baby is negative. She will immediately protect her partner. We know about U equals U. So everybody benefits. But what about the woman who got pregnant not out of her will, who got pregnant because her partner didn't want to use a condom, who is now in this space and tests HIV negative? What benefit is this to them? And I think that was revolutionary for Gilead to include both young people and pregnant and breastfeeding women. And it was just not, you go out and it's okay, we're going to test you when you're pregnant. It was reconsenting. And we've been saying women can make these decisions for themselves. So women decided to stay on the trial. And that is why we have the data that we have. It's because women chose to. And women are always empathetic. Women always see the bigger picture.
That's a
No, it's very powerful.
I mean, we can clearly see why you've chaired the global community advisory group as you're just talking about this. One of the things I find very interesting is the passion and advocacy, especially the organized grassroots advocacy that's come out of South Africa, mostly related to the HIV movement, but I feel like it's permeated across through other conditions, because when you're talking about the benefit to women and the inclusion of women in clinical trials, on the one hand, academics will say, well, we're worried, we're not quite sure how this would in fact impact women, especially their fetus, if they get pregnant. But in Africa, the majority of the continent is young, and more than half of the continent is women. And so if you're running a trial and you're not including them, then after that, we have a medication and we're still running, chasing after our tails and saying, okay, does this work? And like you said, delaying. Now, lenacapavir is out there. We're hearing about it. And in although there's the scientific aspect, there's the advisory advocacy aspect, which you've clearly played a major role in. So what are some of the important ways in which the Global Community Advisory Group helped with the large purpose trial for lenacapavir?
Yeah, I think apart from advising Gilead and holding them accountable for doing what they promised to do in the trial. As you know, the trials from beginning to end has to include community, has to make sure we review the consent form, we review the trial design, we agree with how women are going to be recruited, we agree on how women are going to be kept in the trial. But I think most importantly was to ensure that Gilead brings their part of the bargain, to say once this medication becomes available and it has to also be affordable. So ensuring that the price continuously come down. And as we know, lenacapavir for treatment, very expensive. The initial prices for this was astronomical, and understanding that Gilead has to make their money for their invention. But we also started talking about how can we make it cheaper. As you all know, South Africa has a huge number of people living with HIV, but this drug is for people who are negative. So we have to play a part in saying, how do we make you, Ella and Ulrich, take a medication for something that you are not sick for? It's not an easy feat. I can even ask you guys, will you take lenacapavir when it becomes available after all my fight? Because that is the thing that has to happen, is people need to understand that this is an option for me. And this goes beyond understanding your risk, but just understanding that this is a medication for HIV negative people. If you are in a relationship, if you with a partner and you're understanding your sexual patterns, it's important for you to go on the drug. So for us, that is the work that we do. We do community literacy. Many people say lenacapavir is a vaccine. It's not a vaccine. It's not teaching itself on how to protect. You are basically taking an ARV to actually prevent you from getting HIV. But even worse is that people understand the language. Our communities know these names. And most of the time, it's also the stigma around using a prevention method. Why are you using a prevention method? Are you loose? Are you busy with things that you are not supposed to? So we bring in that education aspect and giving young women confidence on how to manage these things. Because like I say, our confidence, we just have to wing it. Otherwise, you will be worried about everyone, what they are saying around you, and you'll be stuck with an HIV status that you do not know how to manage. The social media, these platforms are, infiltrated with lots of misinformation and disinformation. And it's also our job to do that, to ensure that people understand what lenacapavir's role is.
Interesting. And I heard you saying we've learned from our community. We learned, I know that you worked with many communities just to get this drug to people, like to understand the patterns. Of course, I, as one person, would say that, well, maybe I would prefer a drug than an injectable because I hate needles. But I would really love to hear what you learned from the communities during your engagement, like to bring this to the market, because we make assumptions sometimes, right? As scientists, we have assumptions that maybe people prefer oral to injectables, but then you went into the communities, you spoke to people, and then you were able to tell that, okay, maybe an injectable will be preferable to an oral. So what did you learn from the communities? What were their needs? What were their hopes and concerns related to this new drug?
Yes, I think that's such a cool question, because a lot of people think that all these HIV prevention methods, we have to choose whether they become an injectable or they are made in a form of a oral or a ring. No, all of these drugs play different roles. So lenacapavir is a long-acting injectable, but we also have things like the ring, which is inserted internally in the vagina and it only protects HIV in the vaginal areas, vaginal wall, as well as PrEP, which is something that you swallow. But it's important to know that advocates like myself, we do not advocate for a specific drug or a specific modality. We are just fighting for and advocating for HIV prevention because we know Ella goes through different times. I hear you're afraid of the needle. Somebody said, I would love to have the ring. Another person say, I'm okay with pills, but I also don't want pills. So that is exactly what we are saying, is that HIV prevention has to be a choice. I don't think we can make it much more simpler to say when you go to breakfast in the morning, there's a spread. Not everybody is expected to eat eggs. Not everybody is expected to choose the fruit, but we want people to choose a prevention method that would work for them where they are in their lives. Some people choose a localized prevention method like the ring because they're breastfeeding. They don't want to expose their baby to the ARV drug, whether or not it affects them. And most of the time it doesn't, but they feel like they want to do them. Some people would not want to use the ring because their partners doesn't like it. Some people would want to use the ring because it is discreet. They don't have to tell their partner. They don't have to tell anybody that I'm using an HIV prevention method. Some people also don't like the pills because it makes a noise in their bags. Can you believe it? Nothing else but that thing makes a noise. So I'd rather go, oh, I'm lazy to go to the clinic. But more importantly, when we think about the economic status of women in Africa, our clinics are far and very far, wide and very far apart from each other. So some women would say that will take away me going up and down to the clinic to go and fetch a modality if I get it 6 months. It is it is groundbreaking in that sense that it takes away so much from the person, that pill burden, that burden of having to go to the clinic all the time. And we know our clinics in the communities we are from, the queues are very long. So sometimes it works for people for different reasons. That is why we need to always talk about choice.
Yeah, talking about choice and considering all these aspects, I think your experience is especially unique, not just because you've advocated for the communities from the grassroots, but also working with the large pharmaceutical companies who, as you recognize, have a primary objective. Obviously, yes, they want people to you know have a better quality of life, but they actually have to make some money because they're in the business
Not
of
some money, a lot
uh,
of money. They
a
make a
lot of
lot of
money.
money from us.
Exactly. So I get the feeling because I get the feeling that there's a lot, and it's been the case actually, that there's a lot for other health advocates to learn from the HIV movement from your experience. I can think, for example, about what you said in terms of communicable diseases, right? We were across the world, we saw the dissonance between what scientists wanted and what communities wanted. And that community engagement honestly wasn't the best. And we, like you mentioned, social media really kicked our butts. And then I think, for example, in Ella's case of children being left out of clinical trials, and then you have to find a way to administer medication to patients with children with cancer. So I would like for you maybe to share what that experience is like to try and get those two parties, which will have seemingly divergent goals, to come together and bring something that will definitely change the treatment and management of HIV in Africa and the world.
Yeah, I think the HIV movement has been exemplary. We literally set up a a whole system, a parallel system to the healthcare of all the countries. We told them, you guys stigmatize against us. We told them your medications are too expensive. We told them so many things. So what other movements are learning and can learn, and I think should use the example, but it's not easy. I am just moving into NCDs and advocacy and, obesity and stuff. And I can see the advocates, they are not really speaking to each other. There are people who literally focus on GLP-1s and how cute they are for the body and their waist. And come on, come. What is the message here? Obesity kills. People need to be able to use prevention methods for obesity. So let's advocate for one thing. So I don't think, even though I think the movement is great and we understand the importance, but once people see, and I almost want to say HIV was the same. Remember the times when people were discriminating against us because they think HIV, we got it because of our lifestyle. It's the same with obesity. It's the same with cancer. It's the same. People need to understand that only lived experiences will take us over this. It's only people explaining and talking about their own experiences. My own experience with diabetes. I said every day as a Black woman who eats from Limpopo, who eats pap, who likes fatty food, who likes fried food, who likes bok and all of those things. Every day when I walk into a room and a conference, I realize none of this helps me to look after myself. Now, how do I advocate to ensure that cancer causing foods are not part of the diet? How do I advocate to talk about, front of package labeling? How do I talk about what just happens when you get into a room when everything is wrong for you? You cannot choose. But the other reality is when we are back home, the food that are the most wrong for us are seen as a status, right? So on a
Totally,
Friday,
totally.
if you are not buying takeaways, your parents are poor. I'm here and I'm already getting texts, Mom, what's for dinner? I'm like, look in the cupboard. No, that's not what we're talking about. We've been looking in the cupboard for the whole week. They want takeaways. So
Mm-hmm.
we have to, within the NCD space, in the cancer space, we have to find ourselves and find a common goal to say we want to do A, B, and C. I also think gardening and all of those things, but I think we all know that one common voice. And with HIV, we had a amazing strategy. Everybody came together. Lawyers, the legal fraternity played part in ensuring South African government provides ARVs because our government didn't want to provide ARVs. The movements in the US, the treatment action groups and those movements, the AVACs of the world fought for the US government to bring down the prices of ARVs. So it was every time just us working together. I think that movement for NCDs, obesity, cancer needs to come together because I think they've also created too many silos. So you're never talking to the same thing.
I absolutely agree. And I always use the HIV movement as what do you call it? Like a guide, like a compass to work, like with my work in cancer. I always look at what people had to do back in the day with regards to HIV and what the HIV movement is still doing now. I feel like the HIV movement has done a lot of advocacy and it's made it very easy to talk about. It's made drugs available to people who would probably not have access to it initially. And now it is this thing that we talk about and we are sure that we could eliminate it in the nearest future. Um, uh, oh, and by the way, I love pap too. So I kind of
The
well,
worst
most,
thing for me.
I know most African food is carbohydrate dense, and one I digress a bit. You were making a joke that when you're in the Western world and they ask you what did you eat today, you're like chicken. Then you mention the carbohydrate, so it's chicken and. But in Africa, when they ask you what are you having for lunch, it's like, oh, pap. then pap and what? Then pap and chicken. So you always call the carb first before you call. Yeah.
Yes, yes.
I totally understand where that's coming from. But let's shift gears a little bit. So you a generic version of lenacapavir would probably be available maybe in 2027. I mean, with a price tag that would be affordable. But you have pointed out that an affordable drug is almost meaningless without funded systems to procure it. So, where do you think this responsibility lies? Is it with the pharma companies? Because, of course, they need to recoup the money that they spent in the trials, right? Or is it with our governments, or should we keep relying on donor funds? Given what has happened in the recent past, you saw what 2025 brought to global funding. So where do you really honestly think that responsibility lies?
The responsibility to procure and pay for HIV prevention methods and making the price go down is the responsibility of all of us. I think even the normal person on the street needs to understand that if we do not have the numbers that is attached to bringing the price down, this will always be an exclusive drug. It will always be a drug that can only certain people can afford. So we need to ensure that when these drugs are procured, these drugs are taken up. One of our biggest challenges, people are not taking up HIV prevention. People are saying people are using condoms. No, the majority of us are relying on U equals U, the partner using HIV prevention, and we don't speak enough about how U equals U assisted us in bringing the numbers of HIV infections down. But I think that responsibility lies with all of us. Farmers also needs to understand they have a responsibility to not make too many, you know, to make the drugs too expensive. Don't have too many roadblocks in making it cheaper. So for me, that is the important part. But also our governments have to take responsibility for the citizens and ensuring that these drugs are accessible in our community. Sometimes access doesn't mean availability. Availability doesn't mean people can access the drugs, because it can be available in a country but not affordable. It can be accessible, but people cannot find those drugs. So everybody needs to play their role, and it's just not the responsibility of one.
That's a perfect segue for your most recent award for the by the American Association for Advancement in Science, who said, so first of all, congratulations.
Thank you. Thank you.
And I believe you said three arms of what is necessary to create new science and translate it for the world. I think without a doubt, the creation is there, but definitely the translation, which you've discussed already quite extensively. What does this mean for you as a community advocate to receive a recognition together with the scientists, and what does that signal as well for HIV research and how things should be done?
Okay, now I'm going to have to be very humble and not cry, because first of all, this award went to three people. It went to to the scientist, the researcher. It went to the person who discovered the capsid, and a community person. So that just shows the importance of the role of participating in these trials, participating meaningfully, or letting community be part from the beginning to end. Like in 2019, when I asked that question, I think what was important is advocates and Gilead held each other accountable, because Gilead had to also listen to us, but also hold us accountable, because we met every other month for how many years? I think it was for 4 years. And that is amazing commitment from not only myself, but from the advocates, from the women in Africa who agreed that we will sit in these meetings, we will learn about the science, we will talk about the price tag, we will talk about access. even before this comes available. But for me, as a woman who's been doing this work forever, who never felt seen, I felt seen. I am the rebel rouser. I'm the person who will tell the people what to do in the room if they don't do it correctly. I am the not so palatable advocate because I don't wait for later. I tell it in the room. So I felt seen. I felt appreciated. I felt that I fought the fights that I've been going through for my community finally yielded some kind of, reward. And
Yeah.
that is what it was about. That award was not for me. That award is and will always be for the young women. It will, because I go into those rooms on their backs. I say, I'm representing African women. I'm representing young women. I am here to bring the voice on the table. And for me, that award was for them. It was humbling. Even how the award was, how it was announced was really bringing the community, at the center. And that was for me very amazing.
Wow, you do deserve it. I like the sentence, non-palatable advocate. I think I'm going to steal that word from you. And you deserve it.
Sometimes ask the people, are you weaponizing me or invite me back? Me personally would not invite me back.
Sometimes you need that one person to stand in the room. And this is how
Thank
far
you.
it's brought us. So thank you very much for all your hard work. Now, the drug has been approved, right, in countries like South Africa, Zambia, and Zimbabwe. This is a major milestone, of course. But what do you think right now is the biggest access and equity challenge that exists now that it's been approved?
So USAID withdrew the funds. So USAID promised us they will give us, this drug, they will pay for it. Now Global Fund has paid for it. Now I think the biggest hurdle would be ensuring that we keep up this, not only the standard, but we keep up what we promise. We keep to our promise. I don't want to see a young person going to a clinic when we said, oh, it's going there. And the first 500 doses that we launched was there. I think we need more doses in country. We need young people to go there and ask for lenacapavir and get it. We do not have the luxury of failing with this one. And we can only fail if the drug is not where we promised the young people and the women it would be.
Yeah. So you've like we said, major milestones for HIV and people living with HIV across the world, especially in Africa and especially women. So looking already at the next steps, right? What keeps you excited about the future for people with HIV, the HIV movement in Africa? So what are some anticipated, obviously, challenges, but where do you see the light at the end of the tunnel for the HIV movement?
I think people living with HIV have fought so hard. Some are here today, some are not. But I think we have set the bar, and I think we should be very proud of ourselves. So we went to the battlefield with very little. We fought stigma, we fought no treatment, we fought exclusions, we fought so many things that were put in our way so that we cannot survive. And we survived it all. We have treatment today because of people living with HIV. We have HIV prevention available today because of people living with HIV, women living with HIV at the forefront. So for me, the light at the end of the tunnel is we will get a cure one day. We will have a vaccine one day because women are busy with intergenerational leadership, transformation, and all of those things that make sure that the young women behind us, Ella and them, don't have to find out where did our voices go silent. They can immediately pick it up because they are in contact with a woman in Africa, a woman in Uganda, a woman in Zambia, a woman in Zimbabwe that can tell them this is how we used to do it and we want you to continue. I think the baton is not being transferred, but we are running together with young women right now. So for me, it's just that the leadership of Africa will be with women. The leadership in HIV prevention will be with women until we find a cure and a vaccine in Africa, where it will be found, by the way.
Yes, I like that. I love that we are hoping to find a cure soon and the cure here in Africa. I have taken a lot of notes from your book today. Thank you very much. We'll be wrapping up soon, but I'd want to know what you would tell the next generation advocates, right? What I have taken some. What would you want to tell them to do? How would you want them to, like, how would you pass this baton forward to them? And for you, what's next for you now?
Okay, let's start with, I think for me, I tell young people every day is an interview. Every single day you wake up, it's an interview. You don't pretend to be somebody else. Just be the best person that you can be. And advocacy is hard work. Advocacy is painful. Advocacy is lonely. But most importantly, this work needs to be done. We cannot, while the space for advocacy, the space for activism is shrinking. We see that people don't want to be challenged. People don't want to disagreement for what they want, where they want the world to go, but it needs strong women. And I always say the hill I'm willing to die on is that strong Black women, because I got it from my grandmothers. I got it from there to say, Mfazi is an Mpokoto. We are strong. So that is the one thing. But also going forward is learn and get yourself the knowledge. Young people need to take up the space and become the doctors, become the scientists. Young people today have the luxury to know a scientist of their color, and we must not take that for granted. The scientists in our days, long time ago, did not look like us. So importantly, take that forward, take that baton forward to say, you don't have to always be the patient, be the doctor, be the scientist, be the one who discovers the cure.
Well, I can imagine being at any event and you're speaking like this. I can see myself walking out and trying to knock down walls. And we're about to change things. And when do we want to change? Yesterday, not now. We want it yesterday. We're going to make it. I mean, it's really helpful to have again that perspective, because, like you said, advocacy is hard work. It can get lonely, but it has to be done, because before you know it, you're the younger generation that was pointing fingers and saying, why is this wrong? Why is that wrong? And then you're the generation who did nothing but point fingers and was not doing anything because you're trying to be palatable, right? You're trying to be accepted. And unfortunately, if things haven't changed and things are as bad as we say they are, then something has to be done. I'd like to know, just as a roundup, with all that experience and looking at other health spaces across the continent. I say this because I think we are really in a challenging time. We can all agree, especially as we see the headwinds changing in global health. What would you say in 2 to 3 points? Like, what's next for your organization or for you in making sure that the gains that have been made so far are maintained?
For our organization, APHA, Advocates for the Prevention of HIV in Africa, is for us to continue the advocacy for HIV prevention, but understanding the intersectionalities of being a woman and being a human being in Africa just doesn't end with HIV. We have education, we have women empowerment, we have to ensure that women are able to, have economic freedom that will take them out of these structural barriers. We also understand that holistically, African women are not only facing HIV, we are facing NCDs. So for me, it's continuously building on the capacity of Black women leaders and ensuring that intergenerational discussions continue. But there are other issues that affect us. So we are moving into working in NCDs, but we are also moving into ensuring that women are economically free. Women can do business. Women can use their speaking power. Women are able to find jobs. So that all of it is the future of APHA, making sure the women are here and not 6 feet under.
I like that.
Yeah.
That women are here and not 6 feet under.
Yeah, absolutely. And the intersectionality, I was just thinking back to some of the activities we've been involved in. I don't know that almost every time we go to a scientific event, it's not only is it mostly scientists, you don't have the community, but when you mention the legal fraternity and their very critical role in the HIV movement, again, going back to that intersectionality, you're not just looking at health, you're looking at education, you're looking at economics and the rest. So you really need to reach out, step out of your comfort zone and break down those silos. I think that's something that everyone who's in the advocacy space really needs to think, needs to think back again and re-strategize. Thank you so much for making the time, Yvette. You've been
Thank you.
so we look forward to hearing about your journey and seeing how more and more women living with HIV or without HIV are benefiting from the advocacy that is from your group APA and from yourself. Thank you.
Thank you.
Thank you so much for inviting me.